Good afternoon. I'm Jan Mold. I'm an Assistant Director for Competitive Events for HOSA Future Health Professionals, and today I'm going to be talking about newborn assessment. This is a critical assessment that has to be thorough. It may be that you will be identifying things that need immediate attention, including possible surgical intervention. One of the first things that happens after birth is an APGAR score, and I've got a short video to help you remember what APGAR stands for.
In this Picmonic, we will discuss the APGAR score, which you will be able to recall by remembering these babies being judged by Virginia APGAR herself. The APGAR score is a rapid systematic assessment tool to evaluate a neonate's overall health. Each letter is for an individual assessment, APGAR, for appearance, pulse, grimace, activity, and respiration. Each assessment is scored a 0, 1, or 2, and then totaled to give an overall score. It is completed at 1 and 5 minutes after birth, shown here by the 1 wand to 5 hand minutes clock. Appearance in mirror, is the neonate's overall skin color. Scores of 0 for totally blue, 1 for blue arms and legs and a pink trunk, and 2 for pink overall are given. Pulse, shown by the heart timer, is rated 0 for absent, 1 for below, and 2 for above 100 beats per minute. Grimace, shown as the baby grimacing, assesses the reflexability and cry ability while being rated a 0 for no response, 1 for a grimace, and 2 if the baby is actively crying. Activity and muscle tone, shown by the baby active with muscle tone, is rated based on the flexion of the extremities. 0 is given for a flaccid state, 1 for some flexion, and 2 for good flexion. Respiration is the last part of the APGAR score, the baby respiration, and is determined by breathing rate and effort. 0 is assigned for absent, 1 for weak crying or gasping, and 2 for effortless breathing. Once each of the 5 areas are assessed, the nurse should total scores, the total scoreboard. These create reference ranges for overall health assessments. A neonate with a lower score may need gentle stimulation, gently stimulating the baby, or oxygen, the O2 tank, to which neonates respond well. In summary, the APGAR score is a rapid systematic score to evaluate a neonate's overall health immediately after birth at 1 and 5 minutes. APGAR are areas of assessment which include appearance, pulse, grimace, activity and muscle tone, and respiration. These scores are totaled, and neonates who initially have lower scores often respond well with gentle stimulation and oxygen administration.
Everything we learned today and more is available inside of the Picmonic learning system.
So the APGAR score. Again, you're going to be judging from 0 to 2, with 2 being the best score. Appearance, pulse, grimace, activity, and respirations. The APGAR at 1 minute, 7 to 10, the baby's good. Normally you're going to give the usual care. 4 to 6, mouth or nose suctioning, and they possibly could need oxygen. 3 or less will be resuscitation. At 5 minutes, 7 to 10 is going to be normal. 6 or less, medical attention and further evaluation is indicated. The first steps in the assessment after the APGAR include weight, height, and head circumference. You're also going to do a rectal temperature, and there will be some pharmacological care that's given to the neonate. They receive 1 milligram of vitamin K intramuscular to promote synthesis of coagulation and to prevent hemorrhagic disease. They'll also receive erythromycin ointment to each eye to prevent gonococcal ophthalmia and also to protect against chlamydia. They'll have a blood sample taken from their heel for blood glucose level, which should be greater than 40. Cord care is going to be by hospital policy. Some use a triple dye, some use alcohol swabs, but the area around is always taken care of and kept clean and dry. The physical exam, you're going to evaluate the transition from intrauterine to extrauterine and to detect any congenital malformations or actual or potential diseases. And this is an infant, may look a little different than the ones you see on TV. This is a coating that's on a lot of infants called vernix, and we'll talk about it later on. Immediately after birth, you're going to do a brief assessment of respiration, circulation, temperature, neurological status, and screening for any anomalies or disease. You want to have minimal disturbance of the baby, and you've got to be really careful not to lower their body temperature by excessive exposure. A complete examination is conducted by a pediatrician or nurse practitioner or PA within 24 hours of birth and again prior to discharge. They'll observe from a distance. They check heart, chest, and pulse before the baby begins to cry if possible. So one of the things you're going to be looking at as you're assessing this baby is its posture. Is there flexion of the legs and arms when the baby's laying supine, which means it's laying on its back looking up. Lack of posture, you'd be concerned about possibly Down syndrome or a neurological or muscular disease. Color is extremely important to note. Cyanosis, as you know, is a blue discoloration. It can be mild at birth, which is normal. The tongue and mucous membrane should be pink. Peripheral cyanosis or cyanosis of the arms and legs may last for a day or two. You can see from the picture the blueness around the baby's mouth, and that's what we would be concerned about. If it continues, you're going to wonder about an obstructed airway, respiratory disease, cardiac anomalies, or neurological depression. Also, you're going to want to watch for jaundice, a yellow discoloration of the skin. It can be common after the second day of life. If it's present the first 24 hours, then it's going to suggest a hemolytic process. It needs to be evaluated further. But there'll be a yellow discoloration of the baby. That vernix that I talked about is that cheesy white covering. You also may see what's called lanugo, which is fine hair on the shoulders and back. That's often seen more in a preterm. They might have white papules on the nose or cheeks. They may have petechia on the scalp and face. You also may note Mongolian spots, which are large blue patches over the lumbar, buttocks, or extremities. Those are common in dark-skinned races and tend to fade over time. The head molds with pressure in the pelvic area during a vaginal birth, particularly if the baby has dropped and been in the pelvic area, then they may be born looking kind of like a cone head. They have fontanelles. There's an anterior and posterior fontanelle, and that should be soft to palpation. The anterior fontanelle is 1 to 3 centimeters inside. The posterior is smaller. It's about a fingertip. Head circumference should be between 33 to 35 centimeters at full term. The eyes, if they're slanted upward, it may be indicative of Down syndrome. If they have large eyes, you should be concerned about congenital glaucoma. If they're too close together, it may indicate possible fetal alcohol syndrome. Red reflex of light, you want to check the retina and definitely report that. Their pupils may be opaque. They can be born with congenital cataracts. The ears, low set ears could be a chromosomal anomaly. Malformed ears could be possible renal abnormalities. Down syndrome, you may see that the ears fold over on the top. You're going to check for patency by using a stethoscope. Babies are nose breathers for the first few months of their life, so it's real important that you make sure there's no blockage because it can be life-threatening. They may have a neonatal tooth present, and that would be extracted. You're going to observe the mouth for any presence of a cleft and look at the neck for any mass or goiter. The chest and respiratory system, the rate of respirations averages between 40 and 60. They may experience short periods of apnea. You don't want to see nasal flaring where the nostrils flare out or intercostal retractions where in between the rib cage you'll see them really struggling to breathe. You want to check their clavicles to make sure there's no breaks there. They may excrete a small amount of milk from their breast. If they have widely spaced nipples, that may indicate a chromosomal anomaly. The abdomen and back, you want to check the umbilical cord. There should be 2 arteries and 1 vein. It may be that if that's not the case, they didn't get all the nutrients they needed during utero. Umbilical hernia can be common and it usually resolves before the age of 2. A tight abdomen or abdominal distension could suggest intestinal obstruction or CTs. You want to look at the back, flip the baby over, and check and make sure there's no midline defects. Spina bifida would be one that you'd be checking for there where there wasn't a complete closure. A deep sacral dimple needs to be investigated. The female, the vaginal opening should be visible. Mucus drainage could be present, and it's not uncommon for it to be bloody. The male, the testes may not be fully distended at birth. The meatus, or the opening, should be located at the tip of the penis. Anus, when you've taken the rectal temperature, you're going to check then for patency and position and an anal reflex. The extremities and hips, bowing of the legs is common, but you should be able to place the baby in normal position without any difficulty. You do want to check the baby for hip dysplasia, which is more common in females. To check that, you have the baby supine, again laying on its back looking up. The hips and knees are flexed to 90 degrees. You put your hands at the end of the femur, the greater and lesser trochanter, which is where the femur joins at the hip. If there's a click or a clunk as the hips are moved, then you really need to have that further evaluated. The extremities, you want to check for polydactyly or syndactyly. Palm creases, most have 3. If there's a single transverse palmar crease, that may indicate a chromosomal anomaly such as Down syndrome. So from head to toe, you're checking this baby out, you're reporting any findings. If you're interested in this area, then I'd recommend you look at HOSA's event, Human Growth and Development. Thank you for your time.